Imagine being told that your two young children would one day go blind and there was basically little that could be done. That is the story of one family. But thanks to some truly amazing genetic therapies, the two children who got such a diagnosis can literally see a bright future. Meg Tirrell has the third part of our series, Modern Medicine.
Let me see that.
Caroline and Cole Carper have been through more than your typical siblings.
I can't imagine it being any different than the two of them being together and going through this together. They've had canes together, they've had to learn Braille together, they've gone to school for the blind and visually impaired together.
Early in their lives, they were both diagnosed with a rare genetic retinal disease called LCA, or Leber congenital amaurosis.
The doctor really said, there's no medical treatments at this time.
Both Caroline and Cole were expected eventually to go blind, but their parents found an experimental treatment. And 2 years ago, the kids enrolled together in a clinical trial. It was with Spark Therapeutics, a young biotech company formed out of research from the Children's Hospital of Philadelphia.
The idea is that we are taking a correct functional copy of a gene and adding it back into the cells that have a dysfunctional or missing copy of that gene or blueprint.
It's called gene therapy, and it's relatively uncharted territory in medicine. The technology uses a modified virus to deliver a healthy copy of a gene to make up for one that causes disease. Scientists have been working on it for decades, but only now are the first gene therapies approaching the market. Spark's is among the most advanced. The healthy genes are delivered through eye surgery. Once they're in place, they're designed to do the work of a normally functioning gene, meaning patients only undergo treatment once.
What we're doing is different. We're actually adding the blueprint in, and the cell then knows how to do the last step, which is to make the protein or the enzyme that might be missing, and therefore that is what creates the potential for it to be a long-lasting effect.
In trials of 41 patients, the therapy is shown to improve both vision and light sensitivity with no major side effects. Caroline and Cole were no exception. Before their surgeries, both kids had trouble seeing in low light. Now, though their vision's not perfect, they say they're noticing big differences.
Good things are to come.
I went outside when it was snowing, and I was like, oh, I can see the snowflakes. It was really cool, to actually see something that I'd never seen in my life before.
Spark is one of several companies developing gene therapies, targeting everything from hemophilia to sickle cell disease to other rare disorders. If they're successful, it will be a new paradigm for medicine, fighting genetic disease in just one treatment.
I thought it was really cool how simple it was and how much it changed my life.
For Nightly Business Report, I'm Meg Tirrell.